morning, everyone. Welcome. Welcome to the final session of Faith Forum, taking place during our monthly Windows on the World sessions here at Eastern. We're really glad that you've come out this morning to hear from our speaker, who's been a real pleasure to have with us since Wednesday. So after this session, I want to let you know that there's a lunch in the dining commons for anyone who would like to talk further about some of these subjects with our speaker. And this lunch will be free to anyone who wants to go. So even if you don't have a meal pass, you can come. And we'd like to extend a special invitation to students to attend this lunch as well. It would be great to have you come out and interact a little bit more with the other people who will be there and our speaker. So let me actually introduce our speaker. He's had several introductions this week, so this will just be another one. But this is a little bit more personal one because in 1999, when I was a young college graduate, I had just finished college, I moved to the west side of Buffalo, New York, and my goal in moving to the west side was to work with children and families and run after-school programs, but I also kind of on the side worked with an organization that was resettling refugees. And we worked in this one building on the west side, and in that same building was Dr. Glick's medical offices, Jericho Road. And so I got to meet Dr. Glick and got to know him over the years that I was there. And then my parents also moved to the Buffalo area and became acquainted with Dr. Glick and the work that he does. And my dad is actually on the board of Jericho Road Community Health Center. So that's personal connection that I have with the speaker and with his work. So I worked in that same building, and since that meeting many years ago, under Dr. Glick's leadership as CEO, the Jericho Road Community Health Center has grown to serve around 30,000 patients, almost all of whom are from underserved and marginalized communities. And as you've heard, the organization has health centers in low-income communities all across Buffalo and then in other countries, including Sierra Leone, the Democratic Republic of the Congo, and Nepal. So I think it's important to note that Dr. Glick's work is really emblematic of what we do here at Eastern: faith, reason, and justice. So his strong faith in Christ and his desire to work against injustice fueled his vision to provide transformative medical care in Buffalo and beyond. And in addition, his leadership and his collaboration skills and his strategic thinking helped to grow this organization from serving hundreds of patients to tens of thousands of patients, all in response to Christ's call on his life to serve people who are vulnerable and marginalized. And this really corresponds to what we are about here at Eastern. So we are very privileged to have Dr. Myron Glick here speaking with us at the end of Faith Forum. So please help me welcome him to come speak to us again.
Good morning. Thank you, Krista. We've both come a long way since those early days. So this morning I'd like to talk about our broken healthcare system from a little different perspective. And I thought I would start with a story that happened maybe 15 years ago. And I've had quite a few of these encounters over the years, but just one that sort of describes the brokenness of our healthcare system and the way different people are treated by that system. So and let me just move my slide here. I got a call one morning as I was seeing patients, and it was from an endocrinologist in the suburbs. And she wanted to talk to me about a pregnant woman that she was managing her thyroid disease during the pregnancy, which I was very appreciative of because I'm a family doc delivering babies, but I'm not a specialist taking care of thyroid disease. And during pregnancy, it's a lot more complicated. So she started to tell me, about a couple minutes in, I realized that she's actually trying to tell me how to manage the case. And I sort of interrupted her and I said, Dr. So-and-so, I appreciate you taking the time to tell me all this, but I don't really need to know this. Like, you're taking care of the patient. And she paused and she said she just lost her insurance. And so she wanted to call me and let me know how to take care of the patient for the rest of the pregnancy. And what got me more than anything after I hung up the phone wasn't so much that her office isn't welcoming to uninsured folks, which isn't new to me. But what really upset me was that she thought she was doing me a favor by calling me and telling me this. And it just frustrated me that she didn't get the injustice of having a woman midway through her pregnancy lose your insurance. You're no longer welcome in our office. The problem that we see across this country is that so many of our neighbors do not have access to basic quality health care. So let's talk about what happens in the United States. There's basically three-tiered system, right? There's folks that have private insurance. My guess is that pretty much everyone in this room or the folks watching have insurance. You students are probably lucky for the most part that either you're required to have insurance to come here or you're on your parents' plan. Thanks to the Affordable Care Act, you get to keep your insurance until your 26th birthday. And then you have to figure it out for yourself, right? And that insurance gets you into doctor's offices that many other people don't get into. In Buffalo, a lot of those are on certain addresses out in the suburbs. Then there's a whole nother type of insurance called Medicaid. There's 84 million people across the country on Medicaid today. That is the insurance plan that's funded by the federal government that's for low-income folks. And having Medicaid is better than having no insurance. And it's also better depending on which state you're in. For instance, if you live in Alabama and you have Medicaid, it doesn't cover dental care for adults, or it may cover your pregnancy and the baby's life for the first 1 year. Whereas in New York State or California or some other states, it covers a lot more than that. But also doctors don't always choose to accept Medicaid. So we have a lot of specialists in Buffalo who just say, well, the reimbursement is too low, we're not going to accept it. Sometimes, though, that's just a proxy for they don't want the kind of patients that we take care of. And so as a family doctor serving in these communities, I have to be almost a specialist sometimes because I know that to see a dermatologist or a rheumatologist, it may take 6 months if I'm lucky to get my patient in. And then there's folks that have no insurance. And even with all the reform that has happened across our country, there still are 30 million people across the nation that don't have health insurance. It depends on which state you're in. In Massachusetts, that percentage of the population is like less than 3%. In Texas, it's about 20%. 20% of the people in Texas have no health insurance. That's incredible. That's a huge number of people. In the USA, it is okay to make a profit on healthcare. And healthcare is really expensive, more expensive than any other nation in the world. It is a big business. In 2020, it took up 19% of our gross GDP. We have developed amazing technology, life-saving medications, cures for many cancers, but the problem is it's not accessible to everyone. The uniquely American idea that the very health of our people is something that can be bartered with, sold, and profited on is the essential reason why our healthcare system is broken. So I talked about this a lot yesterday. I'm not going to go into it very much, but there is an element of systemic racism that is at the heart of why our healthcare system is broken and not accessible to everyone. There was a fateful compromise back in the 1960s that happened. Instead of making a national health care plan, the Congress, because of significant opposition from southern states, formed Medicaid and Medicare. Medicaid primarily being the insurance company for the poor and people of color. Doctors were allowed to opt out. Hospitals were allowed to opt out. Medicare was for the elderly who mostly were white. And then in 2008, when President Obama passed the Affordable Care Act and the Medicaid expansion, the opposition to that plan was primarily from southern states. And in fact, the Medicaid expansion, which really was the catalyst to decrease the number of of uninsured folks across the country, of the 11 states right now that still have not chosen to accept the Medicaid expansion, 7, Alabama, Mississippi, Georgia, Florida, South Carolina, North Carolina, and Texas are in the South. It's my belief, and I'm not the only, this is not an original idea with me, that racism is the number one reason why we do not have a single-payer healthcare system in America. This is personal to me, the idea that our healthcare system is broken and what it means to grow up without insurance. I grew up as an Amish Mennonite kid. For those of you that know anything about the Amish, you know that we don't have health insurance. Now we have a strong-knit community, and so when there is an emergency or you have to engage in the hospital system, the Amish folks have negotiated, say in Lancaster County, with the hospital systems to have a lower rate, and then the community comes together and they have bake sales and all kinds of things, and they pay off their bills. But for individual families growing up as Amish or a conservative Mennonite, you don't have health insurance, and you don't go to the church if you need money to go to the dentist or to see the doctor. And so you pretty much go just when it's really, when you can't not go. And that's the way it was for me growing up. I saw how my parents struggled to make decisions on a basis with their 4 kids. Should they take them to the doctor or not? Is it something that's really necessary? Amish folks don't go in for colonoscopies and preventive care because it's just too expensive most of the time. My own brother right now lives in South Carolina. Medicaid has not been expanded in South Carolina. And he's a small business guy. They run a greenhouse. He's a farmer, basically. And he's a little younger than I am. He rarely ever navigates our healthcare system. I finally convinced him to go for a colonoscopy because colon cancer runs in our family. And he went, and he's now paying off an $8,000 bill for a colonoscopy in rural South Carolina. It's crazy. I mean, our system is so broken. It's so expensive, and there's so many people that just opt out of the system. And it's one of these things where when you have insurance, like, you don't even get it, right? And so we sort of pass each other in the night. Unless you really know of someone, you don't understand how difficult this is. What I have witnessed at Jericho Road is more than I can tell you this morning in 40 minutes. But I've definitely seen things that no one should ever need to see. I remember a 64-year-old man who basically walked into my office blind. He couldn't afford cataract surgery. He was waiting until he gets Medicare at age 65. I remember diagnosing a man with lung cancer and him making the decision, because the large nationally recognized cancer institution in Buffalo doesn't accept people without insurance. He said, Dr. Glick, I got lung cancer. I've been smoking my whole life. I got lung cancer now. I know I'm going to die eventually. I'm not going to put my family through this large bill when I'm gone. And so he just opted out of the system. Can you guys hear me? I've seen diabetics lose limbs because they couldn't afford their insulin. I've seen people with Medicaid struggle to get access to specialists, to medications, and life-saving procedures. People who died just because they had no access or it was too late. I'm going to share a series of 4 stories about my patients. And these are real stories, but they're symptomatic of what I've seen over the years. So this is Michael. I first met Michael, he was our UPS driver. So he would come in the early years of Jericho in his brown uniform, and he would drop off packages. And eventually he decided to become our patient, and we developed a friendship. He was a healthy guy, a little younger than I am. One weekend about 10 years ago, he started to develop a drinking problem, and one weekend about 10 years ago, he had 2 accidents, and the next week, UPS laid him off. And with that, he lost his insurance. He and his wife, Penny, lived actually in the countryside of about 30, 45 minutes away from my office, but they would come in to see me. And they have a little horse farm. They together, she ran a dog grooming business, and he raised horses once he got let go from UPS. And they made about $60,000 together. So they were not poor enough to get on Medicaid, but not wealthy enough to be able to afford the Affordable Care Act premiums, which were about $500 a month. And so even though he knew that he could come in and that we would, have a sliding fee scale and take care of him, he really wasn't. He decided to basically just opt out of the system until one day about 2 years ago on a Friday afternoon, our office got a call from Michael, and he said he needed to see me right away. And so I added him to the end of my schedule. And when I walked into the room, I was shocked because he had lost a lot of weight. He looked very sick, and there was this really ugly, foul-smelling smell that was emanating through the room. And so he told me, Dr. Glick, I've been sick for about 6 months. I've had fevers off and on. I've been losing some weight, and I've been bleeding from my rectum. I just didn't want to come in because, I didn't have insurance. I knew you would take care of me, but you're going to send me somewhere else. They're going to find something bad, and it's going to be a problem. So I said, well, can I examine you? And I examined him, and in the office could diagnose easily that he had a cancer. I would say that what I saw with Michael is not unlike the worst that I've seen in Sierra Leone or in Congo, where people have no exposure to the healthcare system and come in with basically end-stage cancer. And so we admitted him to the hospital, and we kept him there longer than usual because, I knew if I sent him home, he wouldn't get the treatment that he needed. Unfortunately, he died. The Institute of Medicine report says this about being uninsured. The uninsured have, and this is data, right? It's not just me talking. The uninsured have poor health and shortened lives. Uninsured patients with cancer presented with more advanced disease and experience worse outcomes and higher number of deaths. Uninsured patients with chronic diseases like diabetes and kidney disease, although kidney disease, once your kidneys are bad enough and you qualify for dialysis, then we have a government program that gets everyone dialysis, which is crazy, right? At the end of your life, now you finally get insurance. Uninsured hospitalized patients receive less care, poor quality of care, and had higher mortality rates during their hospital stay and after being discharged. It's estimated that uninsured Americans have a 40% increased risk of death. It's very true that being uninsured is really bad for your health. The second story is about Raleigh. So I know him really well right now, and I know his family and his wife really well. His wife is Ethiopian. He grew up in Buffalo, and 2 of their children now are in important roles, along with Esther, in our organization. But when the story took place, I wasn't yet in their lives. So Raleigh worked for General Mills. One of the nice things about Buffalo in the summer is that when you go down to the Buffalo River, the General Mills is right across the river, and the aromas of the different cereals that they are making in that mill come out. So our kids in the early days, they would say, Dad, that's the Cheerios, or that's the Lucky Charms, or whatever. He worked there. When he got his job, he had to make a decision. Is he going to get health insurance for $200 a pay period or not? And he had 5 kids to take care of, and he made a decision that probably a lot of us would make, which is, I'm a healthy guy. I don't need to pay $200 every pay period for health insurance. I'm going to save that money for my family. And so he did fine. But one day he started to develop this pain on his bottom side. And he ignored it, waited 3 weeks until he went to the emergency room. Critics of my thinking who try to assure me that our American healthcare system is okay will always say that you can always walk into the ER and get care, which is true. But they do send you a bill, and a lot of times it's too late. Anyway, by the time he got there, he had this serious abscess that required surgery immediately, and the bacteria had spread to his blood. And so he ended up staying in the hospital for 1 week. He eventually went home, and he was fine, but he ended up with a big hospital bill, I think around $17,000, and he stayed away from the hospital. Well, a couple years later, by now his wife, Esther, was working with us. One day she came to me and she said, "Dr. Glick, I need your help. My husband," and he went on to tell me a little bit about his story. And I said, "Bring him in." I brought him in. The infection was just coming back. But this time he got it in right away. I put him on a $4 antibiotic, and he was fine. But today, still, he is paying off that hospital bill. He takes, I think it's like $100 a month or something that he's paying it off. Healthcare is incredibly expensive if you have to pay for it yourself in this country. This is an aside, but in the DRC in Goma, our basic charge for a C-section is $110 for the whole thing, including the hospital stay. And there are many people that can't afford that, and we have to do it for half price or free. C-section in this country is probably $12,000 at the very least. Because of the incredible healthcare expenses, medical debt is the #1 cause of bankruptcy in the United States. I was talking to someone yesterday at lunch from Canada, and he was complaining a little bit about the Canadian system. There's no perfect system. It looks perfect to me, looking across the river from Buffalo to Canada. But I came at him, I said, do people get in debt in Canada because of medical bills? Do they go into bankruptcy? He said, no. I said, it's the #1 cause in this country. An example of why this is so expensive is, I want to tell you a little bit about this medication. And it illustrates profit, motive, and the greed that's in our system. So hepatitis C is a liver disease that has caused a lot of trouble across the world. If you have this virus, there's a chance that your liver will eventually fail and you could die from it. And prior to 2017, the medication we had to treat it was a 50-50 thing, and you would have to do it for a year. There were injections. I had one patient one time, it causes psychosis. One patient stabbed himself because he was on the medicine. So many people just decided not to get treated. And a lot of patients I wouldn't even send for treatment just because it wasn't that good. Well, great new medicine, works 99% of the time, revolutionary, like we have good technology. But the company, Gilead Sciences, decided to charge $500 a pill. And you have to take the pill twice a day for 3 months. So basically, it costs $1,000 a day for 3 months. And there's hundreds of thousands, millions of people with hepatitis C across our nation. In I think 2018, Gilead Sciences made $53 billion in profit off this medication. The CEO that year had a salary of $16 million, and the company decided to put $20 billion of their profit in an offshore tax loophole related to Ireland to avoid paying taxes. They had created a drug which was amazing, but they decided to charge an obscene amount of money, which means it's going to limit the access to folks that can afford it. And at the same time, they figured out a way to pay less taxes, which actually could help our nation afford to buy the medicine in the first place. And this is just one drug. This happens all the time. Greg is someone that I've known for 20 years. He now is our chief of security at Jericho Road. He is a very interesting guy. I would say that I've told him this because I've written a manuscript, and these stories are in this manuscript. So when I was interviewing him and learning more of his story, when I was done, I said, Big O, which is what we call him, you have a much better story than I do. Like, you're the one that should be writing the book. He grew up in a family of 9 kids, raised by a single mom. He was a great athlete in high school, but his college career got detoured or stopped when, as an 18-year-old senior, he got angry and beat up someone and broke their jaw. He was a pretty wild kid growing up. But then he took over, he got his act together, and he took karate, I think, one of those things, and he got like the highest belt level. He's my age now, and he's a big man. He can still kick and hit the top of a door up there. He's pretty impressive physical specimen. He became a very famous security guard, well sought out by lots of people. I'm not a musician, so forgive me for this, but there was a band or something called Destiny's Child that I think Beyonce got her start with. He was her personal bodyguard. There's a famous musician who subsequently died called Ricky James, who's buried in Buffalo, and he was his personal bodyguard. Snoop Dogg is another one that he worked with for a while. What I understand better is football. Forgive me for not knowing much about music. Back in the 90s, the Bills were actually good, and they went to 4 Super Bowls. Well, they had some famous Hall of Fame players, and one of them was Bruce Smith, who I don't think should need a bodyguard. This was a huge, towering defensive end, but Big O was his bodyguard. But when he worked for these folks, all these rich and famous people, they paid him up front. He didn't have his own company. And so a lot of times he felt he couldn't afford to buy his own health insurance. He went from gig to gig to gig. And so but he had diabetes. And when I met him, he was almost blind. We had to amputate one of his toes, and he barely ever got his insulin. So for 20 years, I scrambled to find him what he needed. Thankfully, about 10 years ago, he decided to work for us full-time, and we got him health insurance as part of that. And now he's doing really well. If you're uninsured and have a chronic disease like diabetes, it's a real struggle to survive. The data in the United States says that people with type 1 diabetes. Now, most folks, adults, get type 2 diabetes. They may not have to have insulin. You can use diet, you can use exercise. There's lots of good medications, and a lot of times you don't have to use insulin. Your life doesn't depend on it. But if you have type 1 diabetes, if you don't have insulin, you will die. In that population, there's a study that said that 1 out of 4 people in this country with type 1 diabetes have admitted to have gone at least 30 days without insulin because they lost their insurance or couldn't afford the copay. A lot of times people have to choose between paying for their insulin or buying groceries or paying the rent. Escapes me now the company. I wish I remembered because I'm not happy with these pharmaceutical companies. But back in 1996, they brought another really good medicine to the market. It was revolutionary. It was a type of insulin called Humalog. It's short-acting. It worked right away, and it changed how we managed insulin, diabetics. They priced it in 1996 at $21. Today, that same vial sells for $300. There are some insulins now, some really good insulins that have come out that cost up to $1,000 a month for patients. The same insulin, the Humalog that I was telling you about, today you can buy it for $30 in Canada. We have lots of patients in Buffalo who cross over into Canada to get their medications. Same medicine, just a tenth of the cost. There is an interesting, and this has consequences for people's lives. There's an interesting scientific article that was published a while back that looked at the rates of hospitalization for young people with diabetic ketoacidosis. If you know anything about that, it's type 1 diabetics. If they don't take their insulin, their sugars go really high, they start to vomit, they get really sick, and eventually their blood metabolism gets really acidotic and they go into a coma, and you can die from it. It's a very serious thing. And when you're admitted to the hospital, you're in the ICU for 3 or 4 days. Well, they compared the rates of hospitalizations for DKA in the United States compared to Canada, and it was huge, huge difference. There's hardly any admissions in Canada for DKA compared to in the United States. And the simple conclusion of the article is that in Canada, people have access to insulin, so the idea of going without insulin and being a diabetic is not even something people think about. And yet in this country, it's something, unless you're privileged, it's something that is a constant question. Where am I going to get my insulin? And then Timothy. Timothy came to Jericho in 2011. He loved motorcycles. That's what he did. I think he fixed motorcycles. I'm not sure. He had one himself, and he had a number of accidents. And so by the time he came to us in 2011, he was kind of beat up, was on chronic pain medicines, had multiple orthopedic procedures. And so we saw him a lot. He was a typical, forgive me, I don't say this word very often, but sort of pro-Trump Republican white guy from Lockport who would have, I'm sure in 2011 said, no, we don't need a Canadian-style healthcare system, and, just was very independent and self-absorbed. What happened in 2016, he was indicted, mostly, I think, because of some unscrupulous things that his son did. He was indicted for transporting a large amount of marijuana from Canada to Buffalo. And for that, he was sent away to a federal prison for 2 years. That was a huge problem for him. He lost just about everything, and then he was in jail. And in prison, he lost his health insurance. He lost his Medicaid. He lost his Medicare. There was a law in 1937 that said that when you enter into a prison, we will not use federal money to pay for any health care for you through the normal processes. So people in prison, incarcerated folks, get health care through a different federal fund, which pays for a separate way to get health care, but you don't have private insurance or Medicaid or Medicare. And it's pretty spotty care. And what he told me is, Dr. Glick, when I was there, anytime I went to the clinic, they would, because he had like dental problems, he developed a knee problem, he got a hernia. They would say, well, you're not in here for a long time. When you get out, your doctors will take care of that. The problem was when he got out 2 years later, it takes time to regain those benefits. And for him, even with the help of Jericho, it took 1.5 years to get his Medicare and disability and all that stuff back in place. So we could see him at Jericho, but I couldn't send him for his knee replacement or his dental care or his hernia repair. the data shows that recently incarcerated folks are 12 times more likely to die in the first 2 weeks after they're discharged from prison, and 4 times more likely to die in the first year. Because part of the reason is because they don't have access to health care in a timely fashion. You're discharged, and let's say you have HIV and you're on medications. Where are you going to get your medicines from? Who's going to pay it? It's a huge gap. And so people like Tim suffer. One of the things he told me when I was interviewing for me is he said, Dr. Glick, I changed my mind about that health insurance thing. It's not right that we treat in this country people like this. And so Timothy is one other example of the way our healthcare system fails folks. I'm going to try something here that may be technically challenging for Amish Mennonite guy. If one of my kids was here, they'd be standing right here. But I'm going to show you a video in a second that's going to go for about 3.5 minutes. Has anyone ever heard of, so here's my approach. I'm trying to make a case, right, that our healthcare system is broken. And some of you guys are probably sitting there and you're thinking, I don't know. Well, first of all, you have health insurance, so it doesn't really affect you. And then he's just, whatever. He's just talking. Well, this video, it's like if I'm an attorney and I'm arguing in front of the court, this is my final piece of evidence, all right? And then we're going to talk a little about what should we do. Has anyone heard of an organization called the Remote Area Medical Volunteers? Does that sound like something, an organization that helps people in Sierra Leone? It's in the United States. The very existence of this organization shockingly illustrates the great need in America for basic health care, especially in the South. It's an all-volunteer group of doctors, dentists, eye professionals that provide care in underserved areas all across the U.S., especially in rural areas of the South. They do 2-day clinics, and they have served almost 1 million people. The Washington Post in 2019 did an article on this organization, and I'm not sure if I'm quoting myself here, which is kind of interesting now that I have this manuscript, or am I quoting the Washington Post? But here's the quote. Desperate people lined up to their first camp, desperate people lined up to this first come, first served clinic the night before, camping out in line like they are waiting for tickets to a Beatles concert or to buy the first Apple phone. Hundreds of Americans waited through the night so they could get eyeglasses, have a tooth pulled, obtain medications to treat their diabetes, or get a mammogram. It reminded me of what I see in Sierra Leone. I'm going to try to figure this out. Almost there.
There's such good people in this county. If the poor keep getting poor and the rich keep getting richer, and we can't get the medical assistance we deserve, how can we move forward?
patients they get. My name is Tom Dandridge. I run what's called an edger. It's the machine that actually takes the lens and cuts it to the shape of a frame for glasses. In the very first clinic, we didn't have any of this type of equipment. So we got the truck, and it had machines that they use for rebuilding cars. We got together trying to decide what needed to go in there, and finally got it where we can actually do about 280 glasses a day.
I need a lot of work done, and it's just too expensive to go to a dentist. Wanted to eventually have them all out dentures, like my mom did. If I can't do the dentures right now, I at least want the ones that are broke off out. I just got a job after a year and a half, waitressing. So it took me a year and a half, but I finally got another job. But I can't live with no tooth there.
In a deep breath, blow it out.
Rhonda, are you a smoking person?
Yeah,
No?
I did.
Have you been told in the past that you had spots on your x-ray?
I never had X-ray.
Never had an x-ray?
Just out of the blue, people figure out this is where their glasses come from. They'll knock on the truck and say, thanks, I can see. I haven't been able to see for years. I'm 14 years old, and until today, I didn't know what a leaf looked like. Then that gets you. It gets you hard. We have people in this country suffering because they can't get a tooth filled, or they can't go to work because they can't see. You see the need of the people, and that hurts. With anything that hurts, you got to put a Band-Aid on it to start the healing process. So I try to remember that. We are making a difference for folks in their lives.
So I think I've tried to, this week, to always come back to the basic question of what would Jesus do? And what does it mean as followers of Jesus to actually love our neighbors, right? Like, this is the reason that we should be here, whether it's Eastern College or Jericho Road or a church. We're all created in the image of God. Whatever the issue is when it comes to justice, to the way we treat each other. And this morning we're talking about healthcare. We're treated in God's image. Providing excellent care to every person flows from this belief, this basic idea. Access to healthcare is a basic human right that I believe is ordained by God. If we truly love our neighbor, then it should follow that we design a system of care where everyone gets the care they need, when they need it, no matter what. It's my sincere hope that I live to see the day when America finally decides to assure that health care is given equally to every person in this country. Thank you. We have 5 minutes. Do we want to take questions, or what do you think? Is there any questions from anyone? Yes. Well, I'm going to give you my bias. Like, I think we should tax Mark Cuban and then turn a national healthcare system into effect. Like, I think I mean, it's such a patchwork effort. There's so many good people trying to do good things. Remote medical, Jericho Road, Mark Cuban, I guess. I hadn't heard of that program. But it's a patchwork thing that doesn't really get to the heart of serving people. I don't think we in a capitalistic society can solve this problem. I don't think it's a problem that the church can solve, even if the church took it completely seriously. We need to advocate for our government to across the board, do what they do for public health education, or everyone gets their mail. You know what I'm saying? Like, it should be something that's basic. So, God bless Mark Cuban, but I'd rather have his taxes. That's the way I look at it. Other questions? We have a country that's the richest, 0% make way, way more money. That's allowed. And we have people that are desperate poor like this who can't even get eyeglasses. That's the country we live in. Yes? I know. I mean, I do think we have to, as followers of Jesus, we have to do the things we can do that are in front of us. So, at Jericho Road, that means working with people that are uninsured, and we need lots of other folks that are willing to do that. I think there are stopgap measures that we have to do just because we don't want to see people suffer. But I believe this moment cries out for radical change. We need a politic that cares about people, that puts people first. And I mean, unfortunately, right now our politic is so messed up, so it's hard to have hope that there will be that kind of change. But I will tell you, for me, when I cast a vote, I always look at it first through the lens of how will my vote better help the poor. Other questions? Thank you, guys. I appreciate it.
Thank you so much, Dr. Glick. And I just want to invite you all to attend the lunch. It starts at 11:30 if you want to talk more to Dr. Glick, if you have time. It's going to be we'll get the food from the Dining Commons. It will be eating in Baird Library, and it's free to anyone who doesn't have a meal plan. So you're welcome to come. Thanks, everyone. Good to see you.